My name is David Mondlane from East Mozambique. I'm a data science. So I've been working with this wonderful project. So this is just new era, let's say, because in Mozambique we are fighting, like in many other countries, we are fighting malaria with so determinists, and for years our efforts have been largely reactive. So we responded to outbreaks when a read occurred without anticipate. So sometimes making it easy to prevent an outbreak and suffering. So what this actually brings for us is a connection between climate and health, which makes it more easier and it more easier to know when it's going to happen an outbreak in advance. So the health cares can anticipate. So we have been working with this DHIS2 climate project, and at the beginning, one of the most challenge that we faced is because we didn't have climate data to our models to predict and to anticipate the outbreaks using the climate. So what this brings for us is a new era, so we can connect the climate data like temperature, rainfall, precipitations, and now other variables of climate data, which we can connect with health to get best results in our models. So this is basically a repository for all the data related to climate, which helps the health cares to have this data in grid mode, which is almost the best, and many different resource which they can actually pick which is most suitable for their model. So this is basically a new area. So maybe they can also get global data and local data, because sometimes most of the health health sector are more comfortable working with local data. So besides working with global data, they can work with local data. Because sometimes in Mozambique, we have a lack of station. So if a certain district has no data for climate, so they can still use the climate data because we have the global data. So this is basically, I think, a new era of the models for the health sensitive disease. I think that we discovered so far is that we can learn from the climate data, can model and see which ones that affects really the conditions of a disease. For example, these models that actually we connect the climate data and the disease, we actually can see which ones mostly affect the disease. And we have a choose to choose which variables that we want to integrate. So it's not like picking variables and not seeing what's behind it. So we have a chance to see what is behind. We have a chance to evaluate it and to choose by our own which models that we need to use, which is more suitable for us. So this actually brings us a new way of forecasting. For years in Mozambique, rainfall, temperature, humidity were considered the most climate that affects malaria, because in Mozambique, one of the main causes of death is because of malaria, and mostly affecting children under 5 years old and also pregnant women. So now we are testing rainfall, temperature. We need to also integrate humidity, which we don't have yet. Unfortunately, we don't have, because it's one of the cause, let's say, the climate change that affects malaria, which the country can assume that. But those two we are testing and seeing. We can see a little bit uh, variations and a best evaluation in some districts at a certain point. I think we still have a long path. We still have a long path, and we still have to learn more, and we still have more work to do. because it's not something that we can do from today for tomorrow. We still need time. We still need time to learn, and we still need time to know these tools, to be integrated more with these tools. So we want to test it. We want to expand to other areas that needs this data. For example, there are some behaviors that we find in some mosquitoes in Mozambique, which maybe are related with climate. So we need this data, need this climate data to understand better this behavior. Maybe it can allow us to know what actually how the climate affects this disease, and maybe to know how can we do to control it in some areas.